The secondary article I used is called Dementia Patients' Adult Kids Diagnosed Earlier Than Their Parents with Unknown Genetic Factors That May Affect When Symptoms Arise. And this was based off of the primary article called Association of Acquired Inheritable Factors with Intergenerational Differences in Age at Symptomatic Onset of Alzheimer's Disease between offspring and parents with dementia. So in the primary article, the participants were enrolled from December 1979 to August 2016 and were assessed annually, and a clinical diagnosis of dementia was considered at the conclusion of each assessment and then compared to the parental dementia reportings. They looked at the age at onset, or AAO, of Alzheimer's disease for those who did not present with symptoms when starting the experiment, as well as those who did present with symptoms. And the AAO of AD difference between the parents and offspring were derived for each participant. They just subtracted one from the other. And when both parents were affected, they used the mean parental AAO for these calculations. Other factors were also looked at, including years of education, body mass index, history of cardiovascular disease, hypertension, diabetes, active depression within 2 years, TBIs, tobacco abuse, and unhealthy alcohol use, and they controlled for age and sex. So the results and findings, they had 164 participants throughout that lasted the whole trial, and the mean of the AAO of AD was 70.9 years, and the participants completed an average of 3.5 annual assessments. So 102 of the 164 participants were symptomatic at the study enrollment, and they exhibited a younger AAO at about 69.1 years of age, and the remaining 62 participants had an AAO of 73.8 years. If both parents were affected, they had a mean difference in AAO of 8 years earlier than those with only one parent affected. And when focusing on the other environmental or social factors, as I talked about earlier, they found that it only accounted for 29%, meaning that the biggest influencer of AAO is still to be determined. And a parental history of dementia was common in participants with symptomatic AD that were enrolled, emphasizing the important association of family history with Alzheimer's disease risk. However, the correlation found in this study was small, meaning that there must be other factors involved with the AAO of Alzheimer's disease, so there needs to be more work done on this. So with the secondary article, I felt like the secondary article did an okay job at depicting the primary article, but starting with the title, I felt like it brought readers in because it was intriguing and easy to understand, whereas in comparison to the primary article, it was long and there were some words that need to be understood. But in all, I feel like they got the point across. They used the percentages found in the results from the primary article, but they did leave out some important parts of the paper because the primary article had a lot of statistical analysis and SPSS coding that was not included that explained things more in depth. And the primary article was not completely successful in answering the question, is there a correlation between AAO and family history? They said there was a small correlation, but there had to be other factors involved. And in the secondary article, it kind of just said that the primary article was 100% correct and there is a correlation, and they didn't really go into detail about how there is a difference and there things like that. So I feel like in that way that the secondary article could have been better. And these are my references.